Good afternoon, everyone. I want to welcome you all to Warwick. I'm very happy that Governor McKee chose Warwick today to give this update. Back 9 months ago, when I first became mayor of Warwick, I was a brand new mayor. We were in the middle of the pandemic. I had to try to navigate through that. And at that time, there was sort of a void of leadership at the state level. We weren't getting the information that pleased me the way we were getting it. And I felt that we didn't have much input. I reached out to then the lieutenant governor, and he, being a former mayor, you know, he was very sympathetic. We spoke a lot. He gave me his cell phone number, which I still have. You know, and he facilitated a way with weekly meetings between all municipal leaders that we were able to work with the Department of Health and the state government, and it became very successful. So I'm thrilled. You know, I want to thank him for that leadership he provided then and throughout this. So it's my pleasure right now to introduce Governor Dan McKee.
Yeah, thanks, Mayor. And it's great to be here at the Senior Center here in Warwick, and as our tours of especially long-term health care being on that, and of course the Lieutenant Governor's here now. She chairs the long-term health care. We visited all the senior centers in the state of Rhode Island, and this is one of our favorites. So thank you for having us and hosting this today, and I want to thank Rec. Joe McNamara as well, who is with us, and Senator Majority Leader Mike McCaffrey, I believe, is here on the way. So we're here at the Pilgrim Senior Center today to talk about booster shots. And we have a pop-up clinic on site today for anyone who wants to get their shot, if they are qualified to do so. And at the end of the press conference, I'll be heading over because I am qualified to be in the category to get a booster shot, along with Paulette Hamilton, who's our Director of Constituent Services in our office. We'll be getting our shot today, and we're here to encourage people to make sure they do get their booster shot, as well as getting their first shot. We all have friends that have not been vaccinated yet. I think it's time that we just politely ask them to get vaccinated so they can join a growing group in the state of Rhode Island. I think we're close to 87% of our adult population that is one shot in the arm right now. So I heard that Colleen Wright, who's here, a resident of Warwick, is also going to, who works part-time at the senior center here, is going to give us a few words today, but also I believe that you may be getting your booster shot as well today. So this is an all-in effort to make sure that the state of Rhode Island is safe. So we want to make sure that every eligible Rhode Islander has the information they need about boosters. And we know that information is key in this situation. So consider this our, a booster blitz today, talking about why we need to get out there and keep ourselves safe. So Rhode Island has led the nation in vaccinations. And I've repeated this a few times, that in March there was a great deal of uncertainty in the state, as you can imagine. It was before we had a lot of vaccine. But we did have a very high infection rate in the state, and we had a very high death rate in the state. Fact is that we actually led the nation in those categories, and had one of the lowest, if not the lowest, vaccination rate. Today, last week, we had, I think, the second lowest infection rate in the country. We had the lowest death rate in the country per capita, and to the work that has gone on in the Department of Health, along with municipalities like the mayor, has provided with us the leadership, fourth in the country in vaccinations. That's allowed our economy to open up in a real strong way. And Tom McCarthy and his colleagues at the Department of Health, along with Dr. Alexander Scott, they really have helped lead the charge here to keep the state safe. And we want people to know that we're living in a state that's safe, but we still have challenges, and we need to make sure we get the booster shots and other people vaccinated. So as we know, some of the most vulnerable Rhode Islanders have already gotten their booster shots, and we thank them for this important step to stay protected from the virus even longer than the first shots have provided that protection for them. I think it's important to remind Rhode Islanders that who's eligible for a Pfizer booster and who is recommended to receive one by the CDC. So Rhode Islanders who received the Pfizer vaccine should receive their booster shot at least 6 months after their primary vaccine if they are 65 years and older, or live in a long-term care facility, or they are between 50 and 64 years old with underlying conditions. Rhode Islanders who have received the Pfizer vaccine may receive the booster at least 6 months after the primary vaccine series. They are 18 to 49-year-olds with underlying conditions are eligible, and also between 18 and 64 years old who are at increased risk for exposure because of their occupation or institutional setting based on their individual benefits and risks. In just a minute, we'll have Dr. Alexander Scott will provide more details and a closer look at the science behind the boosters. Here's my recommendation. If you're considering getting a booster and want to see if you fit one of these eligible categories, call your doctor and have that conversation and ask your questions. Boosters are safe, they're effective, and they're recommended by the CDC. Recently, I got my flu shot, which I encourage all Rhode Islanders to do as well when I was at Operation Stand Down in Johnston a few weeks ago. I think it's important for people to know that they can get their COVID-19 shot and vaccine on the same day according to CDC guidance. While the main focus of our vaccination efforts continue to be ensuring all unvaccinated Rhode Islanders get vaccinated, we want to ensure that more vulnerable Rhode Islanders who are eligible for a booster get that additional protection as soon as possible. So I want to just turn and then repeat some of our Rhode Island's current vaccination numbers. Rhode Island is 4th in the nation in percent of population that is fully vaccinated. Rhode Island is 5th in the nation in percent of population that has received at least one dose of the coronavirus vaccine. And Rhode Island is one of the states with the highest percent of youth aged 12 to 17 who are vaccinated. Number one in testing, that was before I got here and continued after I was governor. And we conducted the most coronavirus tests per capita in the nation during the last 7 days. To repeat some of the percentages, because I think this is important for the people in the state of Rhode Island to know that those who are getting vaccinated are the overwhelming majority of the people in the state of Rhode Island. 87.4% of Rhode Islanders 18 and over have at least one dose. Just under 80% of Rhode Islanders 18 plus have completed their primary vaccine series, and a little over 75% of all Rhode Islanders are partially vaccinated. And 68% of all Rhode Islanders have completed their primary vaccine series, which is, again, in the top 5 of the country. While these numbers are numbers that we all can be proud of, and everybody associated with that work, all our volunteers, our National Guard, our municipal leaders, DOH, FEMA was here for a while as well, we also continue to keep our focus on the number of eligible Rhode Islanders who have yet to be vaccinated. So our countdown started in the mid-200s a few months ago, a few weeks ago back. Right now that number is down to 129,000. And we're tracking this metric closely and working hard to bring that down, which our ultimate goal, as which I put on the table several months ago in the spring, was to get to 90%, and we will, because of the help of the people in the state of Rhode Island and their support. Now, our focus today is on the availability of boosters, but I also want to discuss the October 1 deadline for the Rhode Island healthcare worker vaccine protocol. Yesterday, members of the Rhode Island Medical Society held a virtual session to discuss this topic. The message was clear. The vaccine protocol for healthcare workers is crucial. Our healthcare workers have to be vaccinated to stay healthy and to keep others healthy. We cannot put vulnerable patients at risk when they come to our facilities seeking care. The Pfizer vaccine is now FDA approved. Just like other vaccines that healthcare workers are required to receive, such as the flu shot and the MMR vaccine. Since the vaccine protocol was announced, more than 5,000 Rhode Islanders in the healthcare field have gotten vaccinated. Ahead of the deadline, we're seeing promising numbers from many major healthcare organizations. Care New England and Lifespan have reported vaccination rates of over 95%. And we expect that to grow. That's good news, and there's still time to get vaccinated. The Department of Health has reached out to individuals with opportunities to get the J&J shot, and they are working with organizations on their corrective action plans. We'll have a corrective action plan for both Eleanor Slater and also our Vets Home, which thankfully our Vets Home has had, I think it has had no infections since for the last 3 or 4 weeks. Because Simeon keeps me posted every week on that. We know that it's the right thing to do to keep Rhode Islanders healthy. And I want to thank everyone who stepped up early to get vaccinated and who has taken the time to talk to their colleagues and friends. We will all be safer and healthier because of your decision, advocacy, and care. Finally, kind of shifting into in-person learning. We're very fortunate to have, because of our vaccination rates, because of our the health situation, have all our students in the classrooms. But I want to take a few moments to talk about schools and in-person learning. I first want to thank all our school teachers, our principals, and all support staff for the incredible amount of work and preparation that went into not only getting ready for in-person learning this year, but for the work that goes into operating a school each and every day. We all know that safe in-person learning is the best option for our children, and we want to make sure that our students have as many in-person, undisrupted school days for learning in this year as possible. That's why we're looking into some of the protocols other states have put in place in regards to regular testing to keep the kids in the classroom. I had a conversation with Governor Baker last night, talking about some of the programs that are going on in Massachusetts, and we're certainly going to be following up as we compare notes on multiple things, but I thank the governor for taking the call last night. Specifically, we're beginning the stages to exploring a test and stay pilot program. Starting with one district with a focus on the elementary schools. A program like this is not an easy lift. It will take supplies and human resources and planning, but we've done that with all our vaccination efforts, so why won't we do it in our schools? And all our testing efforts as well, leading the country again. But it'll also take some input and support from parents and the community. Even though it's not an easy lift, I believe that it's worth exploring because it gives our students the opportunity to be in the classroom learning. Over the weekend, I received a call from the superintendent, Wesley, that's interested in us putting all our resources together and to explore that possibility in their community, as well as the school committee chair texting me today. So we see that I've been approached by multiple superintendents that are looking to get more of their children in the classroom and spending less of their administrative time working under certain quarantine conditions that are currently in place. But again, I want to tell you that we're doing very well. I think there was maybe 4,000 of our 145,000 kids that were in quarantine recently. From a percentage point of view, that's strong. We just want to make it better. So we'll have much more to say about this over the next few weeks, including some information sessions specifically for parents. We'll run the pilot for 30 days, study the results, see how many school days were saved by implementing it, and if appropriate, would be to expand on that. And Dr. Alexander Scott, I'm sure, is going to speak to the issue that vaccines are going to become available for the 5 to 11 years old, and that's going to make a significant difference as well as we make sure that our students are in the classroom safely. So we relied on our school communities to make decisions that are best, that meet the students, teachers, and families. As I've said multiple times, we developed the protocols and the policies, and we asked the school departments to make those local decisions. So if you're a district leader who's hearing this and wants more information or wants to be included in this, we should expand the pilot, please reach out to RIDE by emailing backtoschool@ride.r.gov. And with that, I'll turn this over to Rep. Joe McNamara and then Dr. Alexander Scott. But Rep, please come on up and tell us about this great community that you represent and the booster shot.
Yeah, absolutely. Thank you, Governor, Lieutenant Governor, Mayor Picozzi, Dr. Alexander Scott, my good friend, President McAllister of the City Council, honored guest, and our recipient of today's first COVID shot, my good friend, Colleen Rath. Thank you, Colleen, for volunteering and stepping forward. Welcome to the Pilgrim Senior Center. And I know the governor's an athlete and a coach, and he mentioned that this is a team effort. 50 yards from here, 51 years ago, my high school coach at Pilgrim High School said there's no I in team. It takes all of us to win a game. And ladies and gentlemen, the citizens of Rhode Island are on one team to defeat COVID. And it takes everyone being vaccinated, including the booster, which I have received. And I can tell you that I had the first Pfizer 2, no reaction. Had the Pfizer booster, and the only reaction I had was the day after it when I saw a Band-Aid on my arm and said, oh, that's right, I got the booster yesterday. So I would encourage everyone to get the booster, and let's address this as the Patriots in Tampa Bay address winning a football game, and that is teamwork, and that teamwork will make the dream work, which is defeating COVID. Thank you very much.
Thank you, Rep. And Doctor, please, the floor is yours.
Good afternoon. Thank you, Chairman, Governor, Mayor. I also want to acknowledge Kathleen and all the staff and community members here at the Warwick Senior Center. Community organizations like senior centers have been such critical parts of our response to the COVID-19 pandemic here in Rhode Island. So it's an honor to be here. Our community partners have been receiving and giving out vital resources and information to people in the community. They've been hosting testing events and vaccination events for their regular visitors and for the larger community. And now it is great news that many community organizations are helping to make booster doses of the Pfizer COVID-19 vaccine available, as we're seeing here today. Many of the people who are now eligible to receive a booster shot got their initial shots early in the vaccination campaign and will benefit greatly from additional protection. By and large, all of us who have been fully vaccinated are very well protected. But it's helpful to know that for these specific populations who are at higher risk, booster doses are now available for you. These are people 65 years of age and older and residents in long-term care settings, regardless of their age. They can receive a booster shot at least 6 months after their primary series. Also, people 50 to 64 years of age with underlying medical conditions should also receive a booster shot as well. For those who are 18 to 49 with underlying medical conditions, it's an option. You may be able to receive a booster shot, and those who are 18 to 64 who are at increased risk for COVID because of what they do or where they work or live also may be able to receive a booster shot. So people in these last two groups, because it's an option, it's not to the level where we're saying you should, as we are with the first two groups, you have the ability to talk to your healthcare provider to see if they do recommend you to be vaccinated. The fact that it's available for these groups that are at higher risk is great news. It's also important to know all of those who have received our 2 doses are also protected. That's the critical piece, and especially knowing that that opportunity is going to be in place for our younger children in the coming weeks. That's also important. With the more contagious Delta variant's dominance in Rhode Island, getting fully vaccinated, and if you're eligible to get the booster shot, it will help strengthen protection against severe disease in those who are at higher risk. And of course, if anyone 12 and older has not yet received their first dose of COVID-19 vaccine, they absolutely should get vaccinated today. Please let your loved ones know, let your coworkers know, your neighbors, anyone, everyone who is eligible should get vaccinated today. That is our primary protection, along with the other steps that we have talked about: masking, getting tested regularly, the amount of time spent in well-ventilated places, and getting your vaccine. For getting your vaccine, that includes our healthcare workers. All healthcare workers who haven't been vaccinated can still get a J&J vaccine shot today. And everyone else throughout the state is also eligible to get vaccinated. What we've done with our healthcare workers is really told all patients that making sure that you have quality patient care in a setting where you know you will be protected against COVID vaccine is of the utmost importance. We also want to make sure the vaccine is available for people who are pregnant or who are planning to become pregnant. Just yesterday, the Centers for Disease Control and Prevention urged vaccination for people in this particular situation. Pregnant women with symptomatic COVID-19 are twice as likely to be admitted to the ICU. They are at increased risk for adverse pregnancy outcomes if they obtained COVID-19. If you are pregnant, the reality is that COVID-19 presents a risk to you and to your baby. Getting vaccinated to protect yourself and to protect your baby is the best approach. Speaking of our babies, our children, the governor spoke a little bit about schools. We agree 110% with the importance of doing everything we can to keep our children in schools. While some schools may be exploring the pilot program that the governor referenced, I want to make sure that all schools, all parents know about the steps that are in place that every school can take right now to reduce the amount of quarantining that happens and to help ensure that your kids are able to stay in school. It doesn't require anything additional. It's what is at our fingertips and available to schools, students, and parents now. Number one, ensure consistent mask wearing. We have implemented the CDC's close contact exemption that allows students to not quarantine and stay in school if they were wearing a mask and achieving a few of the other conditions met. This is possible to start doing now. So parents, as you send your children to school, help ensure, are they wearing masks? Are the things in place to ensure that masks are being worn consistently? The second step that can be taken is ensuring that 3 feet of distance is maintained for students while they are in school. Since day one, we've been talking about how effective social distancing is to reduce transmission. That space helps decrease the risk of transmission, particularly within an unvaccinated population. 3 feet of distance is another condition that's needed for that CDC's close contact exemption, along with masks. And the third step is effective contact tracing. This helps us focus on the students who truly are close contacts and really helps us limit the number of students who are quarantined that aren't close contacts. Parents, families, school communities, the way to help schools do this is to ensure that they are keeping accurate seating charts, both for classrooms and school buses. In our discussion with the Centers for Disease Control leadership on this just yesterday, they confirmed with us the most effective way that every student can ensure that we are only quarantining those who need to be quarantined and keeping as many children in school as possible is to ensure that masks are being worn, is to ensure that 3 feet of distance is maintained, and ensure that all of the steps to allow for contact tracing are being done. Are your seating charts being maintained? Are we able to tell where students are and be able to make the difference in determining whether or not someone can actually just stay in the classroom? So please know that this is what works. These are the areas where we can focus. We're very close to having a vaccine for our younger students. Some health officials are speculating that we could have vaccine for children 5 to 11 years of age in a matter of weeks. The vaccine available for these students will be another tool to limit spread, limit quarantining, and keep children in school. We want to ensure that everyone understands these are the critical ways we can make that happen. One last topic I want to address briefly today is testing. Demand for COVID-19 testing is very high right now, and that is an excellent thing. We want everyone to continue to access the resources that we have. Most PCR test results are coming back within 48 hours. There are a small percentage that are coming back slightly later than that. Our testing turnaround times are right on par with numbers of testing turnaround times in states throughout the country, if not ahead. But we are aware of the feedback and are responding by doing things like working to expand and improve our lab and operational capacity so that everyone, more than the 90+% already that are experiencing the 48-hour turnaround, but everyone gets to do that. Many of you contact the Rhode Island Department of Health directly to schedule your tests or get results, and we want to continue to encourage that. That number has increased quickly and significantly, which is great. Our COVID-19 call center and inbox are experiencing a high volume of calls and emails right now as we adjust to that increase. Keep that coming and continue to know that you can access self-scheduling for your test online at portal.ri.gov. And if you're contacting us about your test results, in addition to being able to check for those results online, be patient and know that our teams are working hard to make sure that we can respond and continue the advanced work with testing and vaccination that we have been accomplishing here in Rhode Island. So with that, I will turn it over to Tom McCarthy. Thank you.
Good afternoon, and thanks to everyone for hosting us here today. I also want to start out with thanking the whole statewide response team and our healthcare providers around Rhode Island that were able to begin administering booster doses within hours of full approval from the CDC last week. So fantastic job across the board so we could get shots in arms as quickly as possible. So with that, we've administered more than 4,600 booster doses since last Saturday, and we have the supply and the infrastructure ready to go to provide that third dose for anyone that's eligible in Rhode Island. So we're also anticipating that we're going to see authorization for Moderna and Johnson & Johnson booster doses in the near term. And again, we've been planning for it. We have the supply, we have the infrastructure, and most importantly, we have the partners across our communities in Rhode Island to be able to begin delivering that. So in addition to planning for the booster doses, what we've been really excited for and been planning for quite some time is to start administering the vaccine to 5 to 11-year-olds across the state. Of course, the next steps are going to be to continue our planning in partnership with our COVID-19 subcommittee, our community, and our municipal partners. But we anticipate that we'll be able to administer those vaccine doses to 5 to 11-year-olds through all of our existing channels. So pharmacies, our state-run site at Saconaset, our municipal sites, and we're going to repeat our school-based clinics that have been so successful both this fall and last spring. However, we also know that for many families and their children, their primary care provider is the place that they're most familiar with and most comfortable with when they're receiving care. So for that reason, we've been working closely with primary care physicians, family medicine, pediatricians to get them onboarded to provide the COVID vaccine at their locations. So currently, of the 134 pediatrician and family medicine practices in the state, we already have 53 that are onboarded. Many of them are already administering doses of the vaccine to those that are 12 and older. So this is a great start, but obviously we want to get that number higher. So what we'd ask is, while we do that work on the logistics side, the administrative side, that we ask our parents to start having those conversations with that healthcare provider you trust about the COVID vaccine. We'll get more detail and answers to more questions as we get guidance from the FDA and the CDC, but start having those conversations now. We know you're far more likely to vaccinate your children if you yourself are vaccinated. So questions are normal, questions are good. The best place to go with those questions is your healthcare provider. Your child's doctor is the person that you've trusted them to take care of your child throughout their entire life, since they were a baby. So please, if you have questions about the vaccine for yourself or the vaccine for your kids, speak with your trusted healthcare provider. So with that, I'll pass it on to Carlene.
I guess that you can see by having someone help me, I am a senior. So I'm very happy to be here to talk to you today on behalf of the seniors of the city of Warwick and the Pilgrim Senior Center. This is my best job I ever had. I am also a member of the silent generation. Now, what difference does that make? It makes a difference. I am here because I was vaccinated for smallpox, TB, polio, and the various flus that have come along. I did have COVID in October of last year. I was very careful not to go to where we said. I got it from sitting next to a daughter who had a cleaning service. I was very fortunate I did not have it bad, and I could breathe. So in February, I had my first 2 Pfizer shots, and I'm very happy to be able to get the booster today. All of these things have kept me alive, and has kept a lot of you alive too. I do not want to get it again and give it to someone. I want to protect my family and your family, and I would hope that you would feel the same way to protect me. I have trusted our system and believe in the system for our welfare, and here I am as proof. So I thank you very much for listening to me as a senior, and I'll pass the word along. Thank you.
Thank you, Charlene.
Oh, cool, thank you. Dr. Alexander Scott, on breakthrough cases, is there any data that indicates the breakthrough case percentage based upon which vaccine a particular patient took?
The breakthrough case rate is so low that it would be challenging to differentiate which vaccine in general. We are definitely seeing overall effectiveness that is in alignment with what we understood from the vaccines when they were promoted. But we don't have the specific breakthrough case differentiation by vaccine here now. It may be able to be obtained, but it's important for folks to understand how extremely low that rate is. We have it posted on our website, less than 1%. That's tremendous from a vaccination perspective.
Gotcha. And Rep. McNamara, you said we're on one team here in Rhode Island with respect to defeating COVID, yet from my vantage point, a lot of other people's vantage points, it doesn't seem like we are. It seems like there's people who are opposed to everything that is said during these press conferences for the last 18 months. What do you say to those people?
I would say to them, look at the science, follow the CDC recommendations, that there are a lot of black holes on the web that you can go down, and there's all sorts of information out there that is false. Listen and seek reliable scientific information, and if you do, I would hope you will see the light and join the team that is going to defeat this virus.
Governor, what is the, you said the Department of Health is working on corrective action plans for facilities when it comes to workers and vaccinations. What is the contingency plan right now, come tomorrow or the coming weeks, if there are staff shortages at hospitals and nursing homes? What exactly is being done, or do you not expect many?
Well, I'll defer to Dr. Alexander Scott to explain the strategy that's, in place, but I can just tell you that in the state, we have Eleanor Slater Hospital, like I mentioned in my comments. We have the Vets Home, and we're going to work to get towards 100% compliance on vaccination over the next 30 days. And my understanding is that we can file that, a report that, that documents that, and that's what we're intending to do on the state level. I can have Dr. Alexander Scott give you more details about how that works, if you'd like.
Sure, and I'll just have one follow-up for you. So last week you said you weren't going to, at the briefing, you said you weren't going to back off the October 1st, tomorrow deadline, and then that same afternoon the Department of Health basically gave leeway for another 30 days for critical care workers, which basically extended it. What was the theory in that? Why kind of backpedal on that?
Well, it's not a backpedal. It's responding to the moment that we're in. That all this could change when the Delta goes out to sea, hopefully in a few weeks. But, so you just got to be responding based on where you are at the moment. And I don't consider it a change in pace. We're holding very fast to the fact that we want the healthcare workers to get vaccinated. And the Department of Health has put together some protocols that we would expect that people would take advantage of. But again, it's in compliance with getting 100% vaccinated.
Governor,
all right, I'll go to one more with Brian.
I just wanted to add and make clear that our enforcement starts day one tomorrow, October 1st. Everyone is accountable to achieving full compliance starting tomorrow. Our whole focus with this regulation has been the patient and ensuring effective patient care while supporting healthcare providers in providing that COVID-protected environment for the most vulnerable. So starting tomorrow, we are expecting everyone to be fully compliant and to ensure that patient care is maintained fully. We want to, as part of our enforcement, allow for making sure that no disruption to patient care occurs, and facilities are able to achieve that full compliance that we expect from day one in a way that maintains the patient care stability and no disruption along the way.
How are they filling those homes? Is it mostly staffing agencies?
One more time.
Is it mostly staffing agencies that are filling those homes, if there are some?
Are they mostly staff?
Staffing agencies.
Staffing agencies. By and large, we have a large proportion of our healthcare workforce that is vaccinated. And one of the approaches that's important for everyone to keep in mind is that COVID-19 has impacted our healthcare workforce significantly over the last 18 months. There have been tens of thousands of healthcare workers who have tested positive, disrupting their ability to work and provide care. The approach with this vaccine requirement is to stabilize that and to ensure that we have healthcare workers who we know are protected and will be able to maintain quality care for their patients. So in the very small numbers of situations that we will be handling with healthcare facilities, there have been the adjustments needed. As we have understood, a single-digit percentage of healthcare facilities reported any operational concerns, and that was almost 2 weeks ago. We've had the opportunity to engage with them and to have the steps in place that are needed to ensure that patient care, quality patient care, where patients can be assured that they will not be exposed to COVID through a healthcare worker, can occur in an environment where their care is not disrupted. Our enforcement approach is designed to specifically help us achieve that, while every facility and provider who is required comes into full compliance with this regulation starting October 1st.
To follow on that, if I might, Doctor, or the Governor, do you have assurances from the large majority of healthcare facilities or from larger healthcare facilities that they'll be able to operate uninterrupted?
Yes, the assessment that we did a couple of weeks ago, by and large, the majority of the facilities relayed that they expect to be fully compliant by that October 1st timeframe without having disruption in the high-quality care that is expected.
Okay, we're just going to take a few more questions so that all of our participants have an opportunity to be vaccinated, and you all are welcome to join in that process.
Commissioner, I had the opportunity to ask the governor earlier this week about a practice that's being held by the Rhode Island Department of Health. He claimed not to be aware of it. Specifically, and I'll use the vernacular in the community, a snitch line has been set up in which people are beginning, as citizens are calling it, to rat out folks who are healthcare providers. And this time I'm referring specifically to an advisory that was issued by Ellen Belasco, who claims to be the chief of the Center for Professional Boards and Licensing. And it's a link under RIDOH letterhead that allows people to click on and complain and, as the community calls it, rat out their neighbors. Is this productive in a state where we've got a significant level of compliance? Do we really want to turn citizens against citizens, family against family, neighbors against neighbors? And why is there an insistence, apparently, that there is the potential for a loss of professional licensing when, in fact, there may be healthcare facilities that wish to employ people who may not be immunized?
Your question allows me to make clear that for many years, the Rhode Island Department of Health has had a complaint line that healthcare providers and the public can call to log anonymous complaints about any health or safety issue pertaining to a licensee. That's been a line that's been in place for years. In our communication to licensees last week, we simply included the information about that complaint line so that they could be aware and for the public. We have not developed any new complaint line for healthcare providers to report on vaccination status. This is just making people and the public aware about the normal complaint line approach that has been in place for many years.
Commissioner, do you believe in bodily autonomy? Do you believe that one has the right to control one's body? And what's actually taking coming from
Dr. Alexander Scott, do we have numbers right now of how many healthcare workers are actually vaccinated as of today?
Our latest assessment was mid-month, where it was well over 86% of healthcare workers reported by the facilities. That was a 10 percentage point increase from just 11 days prior to that, which definitely shows that this is working. We anticipate getting the updated approach, looking for full compliance with our regulations starting tomorrow, October 1st.
Thank you all. Let's just wait here just a second. We'll get everyone situated, and then I'll let you know when